This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. So
Yes.
what's your next tip for end of life caring?
The next practice that I find really supportive is to have some sort of centering practice. It may be a meditative practice. It may be something like tapping, if you're familiar with
Mm-hmm.
that.
Yeah.
It may be breath work. It might be a daily practice of yoga or of going on a morning walk with your dog.
Mm-hmm.
Um, but having some sort of practice that you do to really ground your energy,
Mm-hmm.
it can help if it's something that you're able to tap into in the moment. So if
Yeah.
you could even take a few minutes to pop into the bathroom and just really call your energy back in.
Yeah.
So a
Yeah.
centering practice. Oh, sorry, go ahead.
I was just gonna say in thinking of implementing it in the hospital too, like taking a couple minutes, like when I was thinking of centering, I was thinking of just if you're feeling any certain type of way, just naming that emotion that you're feeling in order
Mm,
to just kind of get in as a way to center yourself. And so to
yes.
just be more present in the moment if you're feeling overwhelmed or maybe you feel inadequate to take care of that patient, or just kind of understanding where you're coming from, in that day, I think might be a good way to kind of reset a little bit.
Yeah, absolutely. Absolutely. I think that's super powerful. And you know, we can name and take a moment to notice and name what it is that we're feeling. And we can just kind of take a minute to breathe and to be with it.
Mm-hmm.
Um, my personal practice would look like really just noticing that feeling, noticing what that feeling actually, how it exists in my body. So
Mm-hmm.
I'm feeling overwhelmed. I'm feeling the speed of the hospital. The way that that's showing up is like there's this maybe like tingling in my extremities. There's like a tightness in my throat. There's maybe like this speed, like I feel like my heart is moving fast. And so, like, what is one even small way that I can cooperate with these
Mm-hmm.
sensations that are in my body right now? So, even there in that moment, I might want to just like step back and forth, like noticing my feet in contact with the floor,
Mm-hmm.
feeling that energy move out through my extremities.
Mm-hmm. Mm-hmm.
And then as that wave starts to pass through me, just returning back to my breath and really just it can be helpful for me to notice some sort of resource, something in my life that helps me to feel really grounded,
Mm-hmm.
something in my life that helps me to feel that I'm a part of something bigger and stronger and wiser and more enduring than whatever these stresses are I'm dealing with in this very moment.
Mm-hmm.
And these can look so different for different people. It might be something divine, it might be something ancestral, it might be, the energy of the ocean or an old growth forest. It might be your dog.
Mm-hmm.
It might be a little one that you love that makes you want to be the best person you can be, that reminds you of like these future generations that will inherit this earth. And so when I connect myself
Mm.
to um, a field of energy that takes me outside of the scope of my one little life,
Mm-hmm.
then I feel, oof, I feel so much energetically stronger
Mm-hmm.
than when I walked into this bathroom.
Yeah.
and and I have on board like this resource that's so much bigger than me.
Yeah. I feel like it takes the responsibility and the weight. It dissipates it a little bit because
Hmm.
you can be a vessel, to like
Yes.
help this transition that's so much bigger than just you, than just,
Hmm. Yeah.
Mm-hmm.
And I think that this is a really powerful practice to have on board when you're working in the hospital and you're going from room to room. And in each room, there's, such a unique and complex situation.
Mm-hmm.
Um, and going from like an intense phone call with a doctor or with a family member. And so really just take a moment to kind of clear that
Mm-hmm.
before you walk into that room with the person who's dying. And I want to name that, like, I named a specific practice that I find really powerful. And I know some folks that their meditative, their grounding practice looks so different than me. It looks like I take a break and I go do a couple of flights of stairs for a
Mm-hmm.
few minutes and just like get in my body and then get
Mm-hmm.
back in the room.
Yeah.
Um, so, whatever that looks like is really just perfect for you.
Mm-hmm.